Well, welcome everybody. I think we'll get started here. Welcome to the session today. We're excited to be here, and this session is how to care for the caregivers. And welcome. My name is Dave Bjork. I am a lung cancer survivor and patient advocate. I also have a podcast called The Research Evangelist, and I'm the vice president of the vice president of empowerment here at Gryt Health. So I'm super excited as a cancer survivor to lead this discussion on caregiving, because I know how important it was in my own experience with my wife as my caregiver. So this is really close to my heart. So I'm very excited to be here today with all of you. A couple things I just wanted to mention. I'll be moderating this session. You can interact with the session by asking questions in the chat function and the Q&A. And remember that all of these sessions are meant to be informational, and any treatment decisions should be made by your healthcare team. So I just wanted to point that out. So as I mentioned, I'm super excited today to be part of this conversation. And I've got some amazing guests with me today who are going to introduce themselves in a moment. We have the session itself is how to care for the caregiver. You know, and I think that we know that most caregivers are undercounted and unheard, and sometimes all but invisible. And they often sacrifice their health and deal with the most isolation at a time, and they lack the time to take care of themselves. So this issue can be compounded if the caregiver is a woman or a racial or ethnic diverse population due to inherent inequities in our economic system. So in this session, we're going to discuss how we as a society and individuals can support caregivers to address their emotional and physical needs and create systems where we proactively help the helpers. So again, very excited about this panel today. We have Chris and Sharon Curtis with us. We have Jana Beach and Taylor Patton. So I'd like to kick this off by having brief introductions from our panel. So Jana, why don't you say hello and introduce yourself, please?
Good morning, afternoon, evening. My name is Jana Beach, and I'm coming to you from the great state of Alaska. And I teased the sun is shining and birds are singing, but we actually won't have sunrise for another hour and a half or so. I was born in Los Angeles, raised in Phoenix, and I moved to Kenai by way of Florida back in January of 2008. My parents moved up here in April of 2006, and I came to visit them and absolutely just fell in love with the area and opted to move up here after my parents and I discussed. And as I continued to age, having a child be closer to help out when needed, make medical decisions, that kind of stuff. And so I started my Alaska life almost 14 years ago, and I do not regret it one bit. The decision for me to move up here came in handy, I guess if that's even the right word, when I became my parents' primary caregiver in the fall of 2019. My dad had been diagnosed with early onset dementia in 13 and started having heart issues in 18. And the catalyst for me shifting into my role was my mother was diagnosed with I'll get it. Give me a second. She was diagnosed with stage 4 pancreatic cancer over the Thanksgiving weekend in November of 2019. So I shifted into the role as primary caregiver for both my parents. And she passed away March 2nd of 2020. And then my father passed away April 2nd of 2020. So from diagnosed to death, my mom had 3 months, and then I lost my dad a month after that. So I'm very thankful that I've been invited to come and speak. I think it helps me kind of navigate this thing that I'm going through, and hopefully it'll benefit somebody else. So thanks for having me here.
Awesome. Thanks so much, Jana. Thank you. And Chris Curtis, why don't you say hello as well? You're on mute.
You think I've not done this before? Hi, everybody, and thank you for the invite. I'm Chris Curtis, and I'm the CEO of the Swallows Head and Neck Cancer Charity. I formed it 10 years ago, going through my treatment. So I had throat cancer in 2011. So I had 3 tumors altogether, one at the base of the tongue, one each side of the neck. I went through all the treatment. And my lovely wife who's on here tonight, Sharon, looked after me all the way through my treatment and beyond. And I have to say, I don't know how we didn't get divorced throughout that circle. I wasn't the best patient in the world, and I was a baby, like a lot of the men are. So yeah, I didn't give Sharon a great time. So I went through an awful lot, and since starting the charity up, now Sharon is really driving the caregivers part of the charity, and we really do believe that the health professionals all around the world, if it weren't for our caregivers, it would all implode and they won't be able to deal with it. So our caregivers are one of the most important parts of our journey. And I'll not go on too much about that because I know Sharon will say some, but I'm just honoured to be amongst everybody here today.
Awesome. Thank you so much, Chris. Great to have you, and Jana. And Sharon, why don't you say hello as well? Good to have you here.
Yeah, hi everybody. Yeah, I'm Sharon, Chris's better half. Yeah, he was diagnosed, like he said, about 10 years or so ago now. And I was thrown into the role of a carer, not something I ever thought I would be doing. Never wanted to be a nurse or anything medical. I don't like that sort of stuff. I'm very squeamish. But from, literally overnight, I was turned into a carer alongside doing that with full-time mum, full-time work, and basically having to cover everything because, like Chris said, he was not a particularly good patient. Not sure he's got much better with age, really. But yeah, we've got through it, and Chris set up the Swallows to help patients and obviously carers. And over the years, the carers side has grown with sort of like having gone through it myself and understanding that there is so little out there for the carers, so little help and understanding, both by health professionals and maybe by carers. Really sort of when they start on this journey, not knowing what it is that they're wanting. But, we're through the other side now, and our aim now is to just help others going forward and to hopefully make their journey a little bit easier. And yeah, that's me.
Awesome. Thank you so much, Sharon. Thank you. Great to see you today. And now I'll switch over to you, Taylor Patton. Say hello to the crowd today.
Thanks, Dave. Hi, everyone. I'm Taylor Patton. I work for EMD Serono as the Associate Director of Patient Insights and Advocacy. And so my role within the organization is to really manage our relationships with patient organizations as well as healthcare providers, just to help better understand the patient and provider journey. I also advocate internally to make sure that the patient caregiver voice is represented in the work that we do. And I'll also just take a moment to kind of give some background on EMD. So EMD Serono is actually the healthcare organization of our parent company, which is Merck KGaA, based in Darmstadt, Germany. Not to be confused with our other industry organization partner, Merck and Company. Having said that, I think that EMD is very dedicated to making sure that patients as well as caregivers are fully represented and understood. And so having said that, we wanted to create a few years ago a program called Embracing Carers, which is a coalition of different organizations that partner with us to help raise awareness and create resources and create more understanding around the caregiver experience. And so having said that, I'd love to provide a quick little overview of one of the projects that we did through Embracing Carers that kind of gives a little bit of insight into the experience of caregivers. And that is our Global Care Wellbeing Index. So this was actually a survey that was run during the pandemic because we were trying to better understand exactly what caregivers were going through during the COVID-19 and ongoing COVID-19 pandemic, and how that impacted their responsibilities as caregivers. So if you can go to the next slide, please. So this was, we surveyed just over 9,000 folks that were unpaid caregivers across 12 countries. And if you want to go to the next slide, we can go into what we found. So again, this is during the pandemic, and some of the themes that came out of that were, one, there are clearly rising demands, obviously with the restrictions that were placed on a lot of people and the lack of ability to kind of travel and do things. caregivers were often, relied upon to do more. And so that kind of that's what leads into the second finding is that, it changed a lot of caregiver responsibilities. So you might have been seeing caregivers, administering medications and having to be trained on that. They weren't necessarily, hadn't gone to medical school for. So there's a lot of things that they were forced to pick up that didn't necessarily fall within their realm of comfort. Additionally, that obviously in finding 3 had a profound impact on carers. They reported having, more physical, mental, financial, and social distress than they had previously. It also highlighted inequities in care. So Dave actually alluded to this in his comments earlier. They were often, the people that were most impacted were often women, and particularly women of color. And that shows that, there's some huge disparities there and who that impacts. And then finally, I apologize, my window's in front of my last point, so I'm just trying to make sure I can see it, sorry. We had some opportunities to think through some potential opportunities and ways to move forward based on the responses. So we want to go ahead and skip to the next slide. Just again, to kind of go over a little bit of what cancer caregivers experience specifically. We know that 80% of cancers across the world are diagnosed in people 50 and older. And that would also imply that, a lot of caregivers who are often caring for a spouse around the same age. Cancer, again, is the second leading cause of death around the world. Only second to cardiovascular disease. And a lot of the things that caregivers were having to pick up were, administering those medications. That included, giving them injections, potentially tube feeding. If they had to, address a port wound, making sure those were clean, and changing out a catheter and potentially a colostomy bag. So we can go to the next slide. Sorry, there's a lag. There we go. Some of the three biggest takeaways. So one, we know that caregivers are being relied on more than ever. They are more likely to experience higher levels of mental, financial, and health stressors. And then we also have found that there is a lack of institutional support globally for caregivers. We can go to the next slide. So on that last point, you can see here that there's a lack of resources across multiple institutions, excuse me. So you can see private companies, nonprofit and advocacy organizations, insurance organizations, as well as local and state governments and the local communities. You can see that there is a distinct difference in how these resources are being perceived or offered to cancer caregivers specifically. So we go to the next slide. And so some things that we can do to kind of help support caregivers in this environment is making sure that we are supporting caregivers in the homes, making sure that they have the opportunity to continue to work, but work in a way that gives them flexibility if they need that. And then also, engaging them more in the decision process as we're kind of talking through care plans with the healthcare provider team. Again, we know that there is a lot of stress that was brought on by a lot of this, and we need to make sure that we can help caregivers navigate their way through this the same way that we would a patient, making sure that there's resources there and that there's support and motivation to kind of help get caregivers through this process, because it's not easy. And then finally, again, lack of institutional support. So we really need to find some concrete ways to really help shape and create better opportunities for caregivers to have support and really make sure that they are cared for as well in this process. And just some, for the broader Embracing Cares program as a whole, I just wanted to say that, we continually, as EMD Serena, try to continually seek opportunities to help and support the caregiving community. And some things that we have done in the past with other patient organizations. So for example, we worked with the American Cancer Society here in the States to really help create a caregiving video series in both English and Spanish that kind of helped spread awareness and raise awareness and provide some education around the caregiving experience. We had worked very closely as well with the Association of Community Cancer Centers that offered the opportunity for us to do a webinar series about having to care for cancer patients, older cancer patients. Then finally, in the Bladder Cancer Advocacy Network, we were able to also pull together some resources to develop some tips for how to manage bladder cancer. And then finally, and many of you may have received this in a welcome packet, we developed a brochure that kind of helps provide some additional context as well as some opportunities for resources for caregivers in this brochure. So that's my little spiel for the moment, and I'll kick it back over to Dave so that we can hear from the other panelists.
Awesome. Thanks so much, Taylor. Thanks for level setting this conversation, really. And you talked about the burden of caregivers and the stress. And, we're going to hear from our panelists, who have those lived experiences, as well as myself, who also have lived through it as well. But one of the things when you talk about stress, I'd like to start really by when we talked earlier, Chris, you had talked about, the stress of a caregiver who's thrown into a situation when they didn't ask for it, right? And without notice. And so when we think about, post-traumatic stress disorder, PTSD, it's how do we do a better job of recognizing this, and addressing the needs of caregivers?
I think it's very hard to sort of recognize it and address it, because what we found from caregivers is they're not like patients where they'll come forward and ask for help. Patients will always come forward and want to talk and join meetings, and then from those meetings you can highlight people that may be under pressure. But caregivers don't do that. Caregivers are a different breed, and they tend to have to be the solid one, the strong one. But what they don't do is care for themselves. So on a recent survey that they were looking at PTSD, 78% of those people were married. So if they're married, then maybe they've got other responsibilities like Sharon did, of paying the bills, continuing to work, continue to do everything else. It's very hard to understand that. But I think what we need to do is start recognizing what is PTSD, and, again, what are the symptoms? If we can then all highlight the symptoms around the cancer side of it, then maybe caregivers then will start saying, well, that's what I've got. Maybe that's what I've got. But getting them then to go to a doctor, or getting them to go for someone for support, because that may show them as being weak, and they can't afford to be weak at this point. So I think it's very, very hard, Dave, to say, let's do it at this point, or let's do it at this point. Because how do we get them to open up? Because while they're going through that journey, looking after me and you, Dave, then their main focus is to make sure we get well as keeping everything else going. But there are times, and Sharon may talk about it, where she sat on the promenade and sobbed her eyes out and looking for gin nights with friends, but within seconds they're talking about me and not her. So how do we do it? I think it's a great subject, but I think that on its own is a subject worldwide that we should work together to try and conquer. And with the help of, companies like Taylor and everybody else, then maybe I'll just crack that nut. But if we don't, then I'm afraid caregivers, will start struggling to keep caregivers going. And, and we're assuming that we're strong. Me and Sharon, when we went into this, we're both strong. But I've just heard of a story today that a patient rang me up. He's in a wheelchair, he's got heart problems, and she's caring for him, and now she's just been diagnosed with throat cancer. So who's going to be the carer there? So so while we're strong, we can deal with these problems, but we're not all that lucky. So I don't know the answer, Dave, to be fair, but hopefully from this meeting, we can drive forward, and the audience may be able to give us some ideas what their feelings are.
Yeah. Thanks, Chris. I totally agree. And, self-care is so important. And when we talk about mental health, it's such a broad, it's like a broad brush, So, Sharon, I'd love to hear you talk to us about some of the emotions that you went through and some of the coping skills that you found helpful, and maybe touch on, our caregivers. I think we can probably agree that they're not getting the resources that they need, but can you just walk us through some of the emotions that and coping skills that you went through in your experience?
Yeah, sure. Well, when we first diagnosed, when Chris was first diagnosed, I was fine. It was okay. I managed with it. It was when he'd had the operation, he was sent home, and then, like I say, you've got the squeamish bits that you've got to suddenly do. You've got to peg feed somebody, you've got to clean it, you've got to, look after their wounds, look after the radiotherapy burns, and then that starts putting pressure on you if you've never experienced doing something like that before, and then had very, very little training on how to do peg feeding or how to, when Chris wakes up in the morning and he's still got the pillowcase stuck to his neck, and you've never been told, how do I take that off? You can't, and you're also rushing with children to get them to school and get yourself to work. They're the things that start to build up, but we're never given anything to look after ourselves. We're not told how to do that. We're not told how to take some time out, or to try and learn to meditate, or to sit in a darkened room with some nice music. Nothing like that is given to us at all. Patients come out with packs, help here and help there, and things they can do to help themselves, but we don't get given anything at any time. So I think, some of the emotions I had was frustration, in the fact that you are now running the whole of the household. I'm lucky I was fit and healthy. If I wasn't, I don't know how I would have managed with that. So certainly frustration from the patient, that, Chris, for example, did nothing for himself. He didn't even feed himself with his peg. He decided he was being a complete invalid. So, to have to come home and start feeding him, and he's not put a wash on, and he's not cleaned up or tidied up, and you're kind of like, you've still got your hands and you've still got your legs. Why are you not doing things? But obviously you can't take that out on the patient, or you feel you can't. You're not taught how to discuss things like that with the patient. So consequently, that's more frustration building up, and anger and resentment, really. And again, you can't tell the patient that you resent them, because they're the one with the cancer, not you. But nobody looks at what pressures is it putting onto the carer. We had younger children, so you can't start, putting extra work on them. And plus the fact, we always used to sit down for an evening meal with the children, and suddenly that stopped. So that's another, pressure that's put onto you, that suddenly you're not having your family meals. So myself and the children would squirrel food away in the kitchen, and hope that Chris doesn't come in and see us eating, because obviously he couldn't eat. That again is another, is it a resentment? Is it frustration? It also put a big block on us doing anything. We used to socialise a lot, eat out a lot with friends and family, whether we had people around at the house or whether we went to theirs or went out. That just stopped because Chris couldn't eat, so nobody went out. And again, you wouldn't go out yourself because you felt bad leaving the patient at home. So it's all kind of like, a frustration, but then you get a phone call off someone and you're going, oh, I'm fine, because I think, somebody said that we don't want to show that we can't cope. We don't want people to think that, we're not able to take this on, and we're not strong enough to deal with it. And yeah, Chris is right. I used to drive home from work and stop the car, have a real good cry to myself, get that frustration and anger out to be able to come home and face it. It's only after that you really start looking at it and thinking, actually, yeah, at the time, I'm not sure I realised I was going through all of this, because you just deal with it. It's after that a lot of this, I've allowed it to come to the surface. I mean, to be honest, when Chris was through his treatment, I was a bit like, right, that's it, back to work, back to normality. Let's sweep it under the carpet. And I really didn't understand why Chris wanted to get so involved in making sure the swallows worked and setting it all up. And I didn't really go along with that ride at the start, because I didn't need any more of that sort of like on my plate. But it's only over like the years that I have met with more carers, and I have been to like the conference that we put on, and I've started to understand that actually we do need to do something for our carers, because they're exhausted at the end of it. They're on a journey, the same as the patient, but it's just a different track of that journey.
Definitely.
So,
Yeah. Thanks. Thank you, Sharon. I totally agree. And you mentioned a couple of really important things. You talked about some of that nursing care. Like my wife is a nurse. And so when she took care of me during my experience, it was easier for her in that sense, but most people are not nurses. And so that's a heavy burden. And we often talk, I think too often the burden is put on the caregiver, and to even to seek support, or even think to ask for help. Right. So John, I would love to hear you tell us like what you think, we can do to create a system that allows caregivers, to feel safe asking for help because of some of the things that Sharon just talked about. Well, she can cry her eyes out in the car, but then she's got to put that strong face on. So, what are some of the things that we can do to create a system that, that makes it a safe place for caregivers to ask for help?
A caregiver won't ever ask for help. Let's be real. I refer to it as being in survival mode or being in the trenches, especially with my mother's diagnosis. And I want to be mindful that we do have international people on the call. So I'm going to try to talk as highbrow as I can, so that's all encompassing. But with where my mom's cancer was, the late stage that we found it at, there's still not a cure for pancreatic cancer. And so it's still one of the cancers that kills. It's a late diagnosis. I have been a long-term volunteer with the American Cancer Society. I've volunteered with them since 2009. And I knew when we got the diagnosis that we had an expiration date. And so not only was I navigating the caregiving side, I was also navigating the preparing for my mother to die side. Didn't know my dad was going to throw a whammy at me, but and then managing my siblings that lived in the lower 48, managing my work, managing, and that's why I say you're in the trenches, you're in the survival mode. So most caregivers that I've come across won't wave the white flag and won't say, I need help. I am very blessed that the community I live in is a smaller community. I've been actively involved with the community for years. And so when we found out about part of my mom's symptoms were she was having severe stomach pain and couldn't keep anything down. She thought it was a stomach flu. Joke's on us. And it was because of where her tumor was, it was squeezing off the bile duct and causing all of that to come back out. Because of where the tumor was at, it made it inoperable because there's so many different connections between your esophagus, your liver duct, you're this, you're that. Not a medical professional, don't ever claim to be one. And so to help with that reduction of the bile, we had to actually go to a doctor in Anchorage, which is a 3-hour drive for us, or a 20-minute flight. And by the grace of God and whatever goodness I did in my life, doors opened for us. And because of my involvement with the Cancer Society, because of how heavily involved I was with the community, I knew kind of who to touch to get whatever I needed. I could see how that wouldn't be available to somebody that's in a bigger city or not as connected as I was. And so I would actually not put the pressure on the caregiver to reach out, but to be mindful of when you hear of somebody that has a diagnosis of cancer or heart condition or insert whatever, for us to be mindful. And it could be something as small as groceries. Cup of coffee. When my dad was in the hospital, I had a friend that brought me coffee every day. And it was just 15 minutes to get out of the room with the beeping monitors and to have a conversation. And I also put parameters on of, I can't talk about it. I think Chris had mentioned when his wife, Sharon, would go with friends, they would end up talking about the patient and not talking about her. And I put that in place right away. I also had a really good therapist, and having a third party to say all the things that you know you're not supposed to say and not be judged by it was a huge benefit.
That's awesome.
Yeah. And so having those things kind of put in place, but I think more along the lines, like I said, instead of asking the caregiver to reach out, it's us being mindful of people in our circle that might need for us to step up.
That's a really great point. And I totally agree. And when you said, caregivers are not going to ask for help, and we just hope that they will ask for help. But I think we all can do a better job of being mindful, as you just said. And Taylor, we've talked about, the healthcare system can also do a better job, of helping out. I think of my experience and in talking with you and others about that when you first go in with a cancer diagnosis and you see that team, the care team, and they're always talking about the patient, but nobody turns and says, and we're going to help you too, to the caregiver. So what is the role of healthcare providers? And, do you see like stress screenings are, for patients as they're going, for caregivers as they're going through the experience, or kind of, I'd love to hear your thoughts on that.
Yeah, no, and I mean, I think that's a really great question. I think that what I've kind of seen is, I think what would be a huge help is kind of leveraging the full extent of the care team. And what I mean by that is also trying to, bring in nurse navigators, patient navigators, as well as social workers. Those are the folks that you see that have had more training on how to kind of identify kind of this emotional distress, and are also equipped to kind of provide resources that do that. Traditionally we see them, of course, speaking with the patient because that's why you're there. However, there's plenty of opportunity for these individuals on the care team to work and provide opportunities for caregivers as well. And we need to make sure that we are valuing caregivers as a vital component of the care team, essentially, because, they're going to be the ones that help with compliance. They're going to be the ones that, are going to have to kind of administer these medications at home. And so by ensuring that you've got that network of support around the caregiver, you're also going to see better outcomes for the patient as well. But of course, we need to first recognize that that's an issue and then engage these other members of the care team to really identify what the caregiver's needs are, emotional needs, financial needs, what have you, and then really set them up and put them in a place and provide a plan for them to be able to activate on that, and take as much off of their plate with having to kind of figure that stuff out. They don't necessarily have the mental real estate to kind of think through these things. So being able to really have that person talk it out and create a plan, I think would really help start to create some change within the healthcare community to really be able to further support caregivers.
Yeah, that's great. Thank you for that. And as far as resources, Sharon, sometimes I think of it as sort of a continuum of resources. As caregivers are going through different parts of the experience, right? So that's from the initial diagnosis and through, some of that home care that you talked about, and then the after that you mentioned. So, are there resources available for patients? For caregivers at different times of the journey that you want to share with us?
There possibly are, but I think, like some people have already said, we don't ask for them. Because we're not aware of them. We don't know where to look for them. And for patients, we know there is, because we're told, or they can speak to somebody about it, or you can ring the clinical nurse specialist, or you can ring the doctor. But at no time was I told to give anybody a call for anything, or to speak to anybody, or to be able to get any extra help. I mean, obviously, if we have district nurses come in to check the peg itself every now and again. You could ask them for some advice on how to clean it, or some advice on what do you think I should do with Chris's neck at the moment. But again, that was about what do I do with the patient, and like we've said, not one of these people turned around and actually said, and how are you doing? Or do you need some help? And like you said before, when we actually sit at that meeting and we're first diagnosed with the patient, somebody should be at that point turning around to the caregiver and saying, this pack's for you. This is what you're going to need. This is what you're going to need to understand. This is where you can get your help from. But I can't say I was offered any help from anywhere.
Well, I think that's really the point that I was making. I think I totally agree with you. I feel like, in my experience, the same thing. There was not even it wasn't even a consideration to think of. My wife was sitting right next to me. We're talking to to my doctor, and so. In addition to the healthcare team, Chris, you've shared earlier about not being the best patient, and when I think of my experience, I wasn't maybe the best patient either. In my experience, it was not recognizing the needs of my wife at the time, with 3 little kids, and all the things that she was doing. So how do we talk to patients because I think that would be really helpful too, don't you think? I mean, if we can just get the patient, and maybe it's a conversation with the doctor. I'm not really sure how, but how can we make that a better situation?
There's 2 problems here. One, the health professionals have got 100% eye on you, the patient, and maybe rightly so, because they want to cure you of whatever illness you're in there for. And they almost ignore the caregiver or your wife or your partner or whoever's with you. But I also think the caregivers have a lot to take on as well. So, you could ask Sharon and Joanna about their experiences, and they will always relate to me, the patient in Sharon's case, and mum and dad for Joanna's case. They'll always go back to that person they're caring for. They won't really go deep into what their issues are. Yet if you ask me or you, Dave, about your journey, we could tell them minute by minute, day by day, right the way through. And we'd be quite open and quite happy to talk about it. I do think there's a problem getting caregivers to open up. If we could get them to open up more like a patient does, and to be fair, we even tried it when in our meetings where we take caregivers into a separate room. They still don't want to open up. They'll open up a little bit more, but they don't want to open up because their conversation will always go back to their patient. In some way, they'll direct it back to their patient. And I think that's their guard of, if I start talking about me, I'm going to break down. And if I start breaking down, then all hell will let loose. So if I can now deflect your question to my patient, I'm going to talk about my patient, because that's deflecting the problem away from me. And, Sharon talks about I'm fine. We always hear that. And I put it in chat. It's frustration, isolation, neglect, emotion. That's what fine means. So when you ask a caregiver how you're feeling and they say I'm fine, trust me, they're not fine. And I think from patient's point of view, we have to look for those 2 little words, I'm fine, and then ask the question, are they really fine? But I don't know that work in reality.
It's so true. In fact, I'm looking at some of the comments in the chat, and one of the comments is feeling like on an island within an island, not being able to have those conversations with the care team and such. And so as we're kind of wrapping up here before the Q&A, and if you have any questions, please feel free to drop them into the chat for those of us who are watching today. But Taylor, I want to just really quickly go back to you on, I've heard you talk about the need for sort of this societal infrastructure, to truly give, I think you said systematic, support. I mean, this is we could talk for 6 hours on this subject. So, and we only have a couple of minutes, but what are some of the changes that you see that need to happen?
Well, and this is going to be from a U.S. perspective, at least initially. I know that one of the things that we struggle with here in the States is paid leave for caregivers. It's something that we don't put a lot of value behind, or really try to push in a way that would be really meaningful. And so really kind of shifting or creating an opportunity for caregivers to actually be able to take time for themselves, not only to care for the patient, obviously, but also leaves them the option to go to services that could help themselves. I would also say too, and this is speaking more globally, that again, we need to do a better job of recognizing and recognizing concerns and issues that the caregiver might have, and then putting a plan in place or creating materials that can help, alleviate or address those concerns. I know that Gryt often kind of focuses or has a larger audience for, young adult caregivers and young adult patients. And, as patients get older, caregivers get older as well. And those needs shift and adapt, but there's still a lack of resources for the younger folks that might be having to do this. We've seen this, sandwich generation, so to speak, and seeing that, a lot of times caregivers are the younger caregivers are at the age where they, may be caring for an older patient as well as a child potentially. And so you have to have opportunities and resources that are kind of meeting those patients and those caregivers where they're at to really give them an opportunity to thrive and, take the space to really, take care of themselves. And then, additionally, looking into respite care. These are things that, communities can kind of do to kind of pull together, create opportunities for caregivers to meet, have a support group, really being able to discuss these things. I know Chris said that, even when you're in that support group, you're not necessarily going to be able to speak, but really just at least trying to make an attempt to create a space for caregivers to really be able to kind of breathe and bring in that opportunity to kind of fuel themselves as well.
Yeah, that's awesome. Thank you, Taylor. And I think the this issue of when I think about where I work, and I'm grateful that I work at a place like Gryt where it's very supportive of, because we're a bunch of people who are either cancer survivors or very impacted by cancer. So I know a lot that's not the case with many people, and that some of that stress. And John, I just switch this back to you real quick on some of those barriers, right, to just getting access to whether it's unpaid medical leave or being able to talk to your employer about needing to get paid time. I just kind of give us your thoughts about all of that real quick. I know it's something you could talk about for 20 minutes, but I just would love to hear your quick thoughts on that.
Yeah, I can summarize it fairly quickly. So with me personally, I worked for a small nonprofit at the time, and FMLA, or Family Medical Leave Act, which was what we have here in the States, didn't apply to me because we were a small staff. And so because I'm a workaholic, I had 200 something PTO, paid time off hours accumulated. And so I worked the entire time. It never occurred to me to take a day off in the sense of I need a sabbatical. I'm going to tap out. I worked for a board at the time, so I had 10 bosses and a staff of 4 plus community partners. And I made sure that I told everyone that needed to know what was going on. So if I dropped the ball, they would act with kindness and compassion and not think I was just kind of sloughing off. And so I was very big into over communicating during that time. But if we would have had a national paid leave policy that encompassed everyone and was inclusive, as opposed to, a sieve where people were falling through, that would have been helpful to me, because I would have been able to spend the last 3 months with my mother instead of trying to make medical decisions, trying to write everything down, trying to manage my staff, trying to spin all the plates. And so, that's where it comes into play with me personally is, a national paid leave so people don't fall through the cracks, so we can focus on spending time with our loved ones. I know that not every caregiving story ends in their patient passing. And so being able to take a respite once you get that clean bill of health would have been amazing for others. And to know that I would have had a job at the end of all of this, and not having that residual thought in the back of my mind of, well, if I don't do this email real quick before the doctor comes in to touch base with this person to do this thing, is that going to pull this thread? And then this is going to happen. And then I'm going to lose my job. Right. Because that's the last thing that a caregiver wants to know as they're dealing with all of this stuff, is they won't have a job at the end of it. And so again, trying to keep it short because we could go on forever. And I know that there's a Q&A session, but that's my biggest thing is right now with FMLA, it's a sieve. We still have people that are falling through the cracks, and just being more mindful of caregivers.
Yeah, that was excellent. Thank you so much, John. That was really insightful. I really appreciate that. And we just have a few minutes left, but there was a question in the chat out, and I think I'm gonna share this with you, Sharon, from your caregiver experience. I could ask all of you this, but there's a person who said they manage a cancer center and have an associate who's in the early 20s and is a caregiver for a mother who was recently diagnosed with a rare metastatic breast cancer. As a manager, how can I help support her when she's managing her mother's care on her own and working full time? Sharon, I'd love to hear your thoughts on that.
Yeah, sure. It's I think be there and listen. If the person thinks that that carer needs to talk, then they need to give them the space to talk. They need to encourage them to talk. They need to be flexible with their working, if it's at all possible, because you can be called at a moment's notice that the patient's poorly, or you've got an appointment, or they've had a bad night. If they've had a rough night with their patient, they're very tired the next morning. If they've got some more flexibility on what time they can start or leaving earlier, they're all little things that can help. I think, like Jana said, a coffee break for them, and get them to just try and open up a little bit. You've not got the answers, but sometimes they just need to talk and just need to express how they're feeling. And also, if they're struggling with their job and things are slipping, you need to understand what's happening behind the scenes. So is it because they're tired? Is it because they've had a rough day? Or an upsetting call from the patient? So it's just, keep talking to that caregiver so that they know they've got a place that they can come to, a safe place to talk.
That's awesome. And I think you bring up a really good point. You all have. It's like sometimes it's the little things, sometimes it's the big things. But if we can even just start with the little things, the small things, right? I mean, to be more kind and empathetic, I think is something that would go a long way to helping our caregivers. So we only have a couple minutes left. But I would like if get closing thoughts from each of you. Maybe just give us a minute of your final thoughts, and I'll start with you, Taylor. If you can just kind of sum up what you'd like to share with us.
Well, I mean, I think kind of at the end of the day, I think what I have kind of taken out of this and working with our Embracing Carers program is to just really take the time to acknowledge caregivers for their work, but then also offer them tangible things that they can do. Because oftentimes you'll see, oh, I want to give you a hug. Well, you need more than a hug. You need time off. You need this. So we're just really making sure that we're understanding the needs while also providing real tangible opportunities for caregivers to take care of themselves.
Awesome. Thank you. And Chris, real quick, final thoughts?
I would like to start at diagnosis. We're working on a caregivers box, and I'd like any of the audience that's here worldwide to come back to me with ideas what we could do for a caregivers box. Because if we can do it in the UK, we can do it in any part of the world. And also we run a 24/7 support line for caregivers and patients. And that's not an answer phone service. It's not a message service. It's actually, if someone rings our caregivers line, Sharon will answer that call 24 hours a day, 7 days a week. Maybe we should look at doing that in different countries as well. Because it's the dark hours when the caregivers tend to ring up. So that would be my thought. We need to start looking at helping our caregivers more.
Yeah, that's awesome. Thank you so much, Chris. And Jana, why don't I switch over to you, and then we'll finish up with Sharon real quick. Final thoughts.
I have so many thoughts.
Yeah.
First, again, thank you for allowing me to be here. I'm very honored that I was asked to be a part of this. Two things that I think will be a good takeaway. One for people who know caregivers, and one for caregivers themselves. That was big with my gig. People want to comfort others how they choose to be comforted themselves. And so I had a lot of people, and I don't want to offend anybody when I say this, so please bear with me. My thoughts and prayers are with you. Thank you. That doesn't do anything for me. It's like, offering somebody a hug, and, they need to have, their driveway plowed out. And so instead of saying, oh, my thoughts and prayers, or everything happens for a reason, which was another one that was like, blah, ask them, what can I do for you? How can I support you?
Yeah.
Because again, it helps in that other side of things. With caregivers, create a crap list, implement another 4-letter word, of menial tasks that you don't have to do yourself. So when somebody offers to help, you have something ready, like run my trash to the dump, or plow my driveway, or bring wood up to the porch, or something in regards to that. So those are my 2 tidbits.
Thank you. That's awesome. And Sharon, why don't you bring us home?
Yeah, well, I think this has been great because it's good to see that caregivers across the world are going through the same things, because you do tend to think it's yourself just going through it and nobody else. I think if we're going to start giving advice out at diagnosis for the patient, it's to contact groups like ours and probably others across the world, because the support is out there from these sort of groups, but we just need to push it more and get the caregivers to understand that it is out there for them, and just hope that they get in touch with us, because I think the more we can talk to them, we can't solve the problem, but the more we can talk to them, the more we can give them help and tips and bits of advice. So yeah, thank you very much.
Awesome. We could go on and on this, you guys, and maybe we'll have to do a follow-up on this, because there's so much more we can talk about. But thank you all very much for being here, and thank you all who are watching. It's great to have you all here today. And Taylor, it's been great to work with you. And so this is the end of our session. Like I said, I'd love to keep going, but thank you all to the panelists. And so now that we end this session, we'll begin our interactive intermission. So please explore the conference website, chat live with our partners in the exhibit hall and the research launch pad. And we'll see you in an hour for the next live sessions. So thanks again, everybody.